Hi, I'm Tina Howarth, massage therapist at Academy Massage Therapy. If you're expecting a baby, then today's wellness segment is for you. Whether you are just at the start of this incredible and special time or almost at the end of your pregnancy and ready to get your body back, there are lots of benefits that massage can deliver. We will cover what to expect when you receive a prenatal massage, how to make your growing body more comfortable at home, and of course, all of the great reasons why you should receive a pregnancy massage or prenatal massage in the first place. Also, I'd like to point out that although prenatal massage refers specifically to the person carrying the baby, it's also important to note that for the people who support us and care for us during this time, it's also a good time for them. It's a great tool for them to use as well, because it will help them feel grounded and calm during the very fast changing and exciting world of expecting a new life. Pregnancy brings with it many physical and emotional changes that happen rather rapidly. Frequent urination, breast tenderness, constipation, heightened sense of smell and taste, those are all very common. As you progress in the pregnancy, some people have a little bit of swelling in the hands and feet and a little bit in the face as well. Blood pressure can change quite a bit during pregnancy, so regular checkups with your doctor is a very important part of your care. As well, there are lots of musculoskeletal changes that happen during pregnancy under the influence of three main hormones: estrogen, progesterone, and relaxin. So relaxin, for example, is a hormone that as early as 2 weeks starts to be present in the bloodstream, and its job is to change the composition or to change how much collagen is in the joints. So this will accommodate for a growing baby and also prepare your body for the birth. Common joints that are affected by relaxin is the pelvis, the foot, and the ankle. So a lot of pregnant moms have achy low backs, feet, and ankles. Also, as you come into the third trimester, where there's a lot of changes very quickly as the baby's growing, the pelvis really starts to relax and widen. And at that point, the legs will externally rotate, and a lot of women start to feel a lot of achiness in the back, into the glutes, down the legs, as well as common. And also the baby is getting bigger, and the center of gravity is changing, and so achiness in the shoulder and low back happen at that time as well. Fortunately, massage is a wonderful tool to help with all of those changes, as well as the changes of anxiety and stress of this new phase of your life. Things with massage that you can expect would be a decrease in the muscular tension, a decrease in your anxiety and stress levels, relief for that low back and glute pain, relief for the upper neck and shoulder pain. So lots of good reasons to do the prenatal massage and take care of yourself that way. I also want to talk about what to expect when you come for a massage. So the first thing that we do is we do a little general health form and also get a little bit specifics about how your pregnancy is going. And then depending on your needs for that day, you're going to be set up on the table ready for your treatment. So here at Academy, we use a pregnancy pillow, and it's really kind of neat here, and it has all kinds of parts to accommodate mom and baby. So this first part here is a little bit of a dent in here. I'm not really sure if you can tell on the camera, but there's a little indentation here, so space for baby, and this can be closer or farther depending on how far along you are. Up here there's a little area to accommodate the growing breast tissue as well, and then of course your head. And you can use this pillow as far along into your pregnancy as you are comfortable. As you progress into the second trimester, for sure by the third trimester, when most women get very big, you'll want to switch to side laying position. That position is also, I'm going to show you that up next, but that position is also what you would do to get comfortable at home when you're sleeping at night. So I will show you that next. So this is side laying position that you would be massaged in. It's also a great way for you to sleep and get comfortable at home. Some women have the long body pillow. If that's the case, use that. It's great. If not, you don't need to rush out and buy one. I'm going to show you how to do it with just stuff that you'd have at home. So first thing is you would put a pillow in between the legs. I like to make sure that my pillow is between the knees, and if you can get it right down under the ankles, that's even better, okay? So something between the knees. Then this one I want to show you is very special. So imagine, okay, that I have a little bundle here. So you would lift the tummy a little bit, lift baby and slide this underneath. You can even roll it if you need, okay, and then lay baby on it. What this does is it straightens out baby so that you don't have pulling on your back when you're side laying. It will make a huge difference in comfort. Then next you'll have something under your head, ideally a little bit higher than what I have here, okay, but just for today's sake, you kind of get the point that you want something to keep the head not too low and not too high, but nice and neutral. So I'm just going to hold it there. And last, this is a super special and important one. I roll up a blanket. I do it in clinic too. This is what you would have if you come and get a massage here. Rolled up, and I tuck it like this, like a little teddy bear, and you can even put it under your head if you want, and then like this. So the purpose of this is to support the elbow so that it's a nice relaxed position and it's supported, as opposed to not having it and everything being contracted here, okay, and bent, which is not comfortable for the neck. So side laying, and then you would flip and do the other side as well. And then we'd finish with you in a head up position, and we have a special pillow for that here at Academy as well. It is the wedge pillow. So I will show you the wedge pillow installation next. So this is the wedge pillow that you'd be using when you're laying face up during your massage. This way you're not going to be fully reclined, which will make it a little bit easier to breathe. And it's also safe to use for baby because the circulation for baby is on the right side of your body. So this way there won't be too much pressure for you. Some essential oils that you can use at home are lavender, chamomile, and tangerine. Those are safe to use. Arnica, which is used for reducing inflammation and muscle soreness, that is also safe to use during pregnancy. You can find that in a pharmacy, and probably cream-based is going to be the easiest way to use that. So last part is, how often should you come for prenatal massage? So in the beginning, the goal of the prenatal massage is to really relax you and take care of you mentally and emotionally, because there's a lot of new feelings and anxiety that comes with expecting a baby. As you start to grow and the body really changes in the second and third trimester, you'll find that every week there's going to be something new that is uncomfortable. So at that point, then I recommend putting the treatments closer together, and you can use them right up to delivery day. In fact, some people even use a specialized care provider called a doula, who is there specifically to look after mom and her comfort. And they use quite a few massage techniques even to help keep you comfortable during delivery. After delivery, so postnatal care, there is a place for massage as well. If you've had a natural childbirth, you can come back as soon as you're comfortable. If you've had a C-section, my guideline for that is that you'll be able to kind of turn fairly comfortably from side to side at home. Once that happens, I guess around the 4-week mark, depending, then you would be able to come back and receive massage at that point too. And remember that, again, we can accommodate you with lots of pillows so that if it's not comfortable face down, we can always use side laying again at that point. Also, some moms find that they might want to wait until they've gotten used to baby's feeding and sleeping schedule. So this way that might be a little bit easier to come in and get a massage at that point too. So that pretty much wraps up today's segment on prenatal massage. I hope the things that we've covered today will help you in your quest to feel better. So keep in touch with us via Facebook, Twitter, and our website. And thanks for spending some time with me. We'll see you soon.